Good day everyone, my name is Christine Alam Sumawang and I'm a student nurse from Tarlac State University from BSN 2B, and for today I will be performing a performance evaluation checklist about the Leopold'S maneuver. Okay, so the Leopold'S maneuver is used to palpate the gravid uterus systematically, and also the methods of abdominal palpation is of low cost, easy to perform, as well as non-invasive. Okay, so the Leopold's maneuver is used to determine the position, the presentation, as well as the engagement of the fetus in the utero. Also, it is used to assess the fetal presentation, the position during the third trimester of pregnancy. And now we will proceed to our next step, which is we need to check the physician's order or the doctor's order. Okay. So based here in the doctor's order, I will need to perform a Leopold's maneuver to a woman that has or that is currently in her 28 weeks of gestation with a obstetric history of G1, P0, T0, A0, and L0, which means this is her first labor or pregnancy. Okay. Also, it is indicated here that the patient has no latex allergies. Okay, so we're good to go. Now after that, we will need to assemble all of our equipments. We do need to gather the equipments needed, such as here is the stethoscope for the fetal heart rate monitoring. Next is the pen, also our notebook, as well as in here. Next is the alcohol, okay, that we will be needing. And after that, we'll now move on to our next step, which is we need to introduce ourselves to our client. We need to identify our client, as well as we need to verify the client's identity. And also we will be explaining the procedure to our client, what we're going to do, why is it necessary, and how the client can cooperate. Okay? So good day po ma'am, my name is Christine Alam Sumawang and I am a student nurse po from Tarlac State University from BSN 2B po. And for today po, I will be your student nurse. Is that okay po? Okay, so for today po ma'am is, base po sa ating doctor's order is, magpro-provide po ako ng Leopold's maneuver po sa inyo po. Ang Leopold's maneuver po ay ginagawa po natin para ma-determine po natin yung fetal presentation po, as well yung position po, and kung naka-engage na po ba si baby sa inyo pong pelvis. Okay po? Okay, so hingi lang po ako ng consent ma'am because I will be touching po some various areas on your abdominal area. So okay lang po ba sa inyo na mahawakan ito? Okay, so okay lang naman po ba sa inyo na isang student nurse po na lalaki ang gagawa po sa ating procedure ngayon?
Okay lang po.
Okay, so huwag po kayo mag-aalala ma'am kasi ang gagawin po natin is i-expose lang natin po kung ano po yung mga dapat expose during the procedure po. Okay po? Okay, and after that, we will now proceed to our next step, which is we need to provide some privacy for our client by closing the curtains around the bed and closing the doors to the room if possible. And after that, we will now proceed to our next step, which is we will be positioning our client to a supine position. So she is already in a supine position, but we will need to elevate slightly her head. Okay, so the head is already slightly elevated and the feet or the knees should be slightly flexed. Okay ma'am, so taas po natin konti lang po. Okay, that's good po, no? So ginagawa po natin ito ma'am para maiwasan po natin yung sudden drop of blood pressure po. Okay po? Okay, next step po is I will need to perform hand hygiene and observe other infection control procedures. Okay, so since our hand now is wet and it indicates cold, so after we dry our hands, we need to rub it to make it warm, because cold arms or cold hands could promote or could indicate or could cause uterine contraction, and we don't want that to happen. Okay? So ma'am, ready na po ba tayo sa ating procedure?
Ready na.
Okay, so sabihin ko lang po na meron po tayong apat na gagawin, which is yung 1, 2, 3, 4 Leopold's maneuver po. Okay po? So yung una po natin gagawin ma'am is yung first maneuver po, which is called the fundal grip po or the presentation. So what we're going to do here po ma'am is to determine po the presentation po ni baby or the fetal line po or lying position po ni baby. So it's either po na ang mapapalpate po natin is yung head po ni baby or yung buttocks po ni baby. So pag ang napalpate po natin yung ulo po ni baby or yung head po ni baby, ang mararamdaman po natin is smooth, hard, firm, and round po yung ulo po ni baby. And kapag buttocks po yung ating pong na-perform or ating pong napalpate, ang mararamdaman po natin is smooth po and has bony prominences po. Okay po? Okay, so ang gagawin po natin ma'am for this procedure is I will be standing at your side po, facing you po, as well as I will need to make a triangular shape po using my both my hands, and I will be palpating po yung inyong pong abdominal area. So ang i-assess po natin is for the shape, the size, as well as the consistency po and the mobility. So before that po ma'am, okay na po ba? Ibaba na po natin yung ating pong kumot. Okay. So let's say, for example, I have already um, pulled the mother's dress up to the xiphoid process. Okay. We'll now do our procedure, which is we need to make a triangular shape of both our hands, and we will be palpating it. Okay. Okay, so based po sa ating findings, ma'am, as I have assessed, ang naramdaman ko po is yung head po ni baby, yung buttocks po ni baby, yung ating pong napalpate, which is soft, as well as meron po tayong naramdaman ng mga bony prominences. So, meaning to say po, we can conclude po na si baby po ay naka-cephalic presentation. Okay po? So, pag sinabi po natin cephalic presentation, ma'am, yung ulo po ni baby yung una pong lalabas during the labor. Okay po? Okay. And now we will proceed po, ma'am, sa ating pong second maneuver po, or what we call as the umbilical grip. Okay, this is also called the fetal lie po. Okay, so what we're going to do here po, ma'am, is we will be determining po the position po ng back po ni baby, as well as yung small parts po. So pag sinabi po natin small parts, ma'am, it includes po yung mararamdaman po natin yung knees and yung legs po ni baby. And yung back naman po, dapat po mararamdaman natin is smooth, hard, as well as resistant po, no? Okay, so ang gagawin po natin dito is I will hold po yung inyo pong one side of the abdominal area nyo po, and I will be, as I hold it po, okay, so using my right hand, I will be applying gentle and deep pressure po, okay, and my left hand naman po, yung gagawa po is i-feel po niya kung firm po ba yung back, or mararamdaman po natin yung back ni baby. Okay, so tama po, nandito po yung back ni baby, no? So it is important po na alam natin kung nasan po yung back ni baby, para po doon po natin ilalagay yung fetal heart monitor niyan. Okay po? Okay, now that we are done on the other side, to confirm our finding, we will be doing it on the opposite side of the mother's other side of the abdominal area. Okay? Okay. Okay po. So based on our findings po, mami, ang back po ni baby ay matatagpuan po sa inyo pong left side, okay po? And yung small parts po niya, which includes the knees and the legs po, ay matatagpuan po sa inyo pong right side, okay po? Okay, so we will now proceed po sa ating pong third maneuver po, or what we call as the Leopold'S grip. So what we're going to do here naman po, ma'am, again po, I will be facing you po ulit. So ginagawa po natin ito para po ma-determine natin kung si baby po ba ay naka-engage na po sa inyo pong pelvis. Okay po, kung naka-enter na po siya sa pelvis. Kasi po, kapag naka-enter na po si baby sa ating pelvis, hindi na po natin magagalaw yung ulo po ni baby, dun po sa ating pong lower part naman po ng ating pong abdomen area. Okay po? Okay po, so start na po tayo. So using my right hand po, I will be using my thumb as well as yung aking pong pointer finger or aking pong index finger. I will be gently grasping po yung lower portion po ng inyo pong abdomen. Okay po? So after that po, I will try to lift po yung head po ni baby and try to move it and move it around po. So kung hindi ko na po na-move, as I said earlier po, meaning po hindi na po naka-engage na po si baby sa inyo pong pelvis. But kung na-move pa po natin siya, or we could lift the baby's head or pull it back and forth, meaning po hindi pa po naka-engage yung ulo po ni baby sa inyo pong pelvis. Okay po? Okay po, so other thing po, ginagawa po natin itong third maneuver to confirm po yung ating pong conclusion earlier sa ating pong first maneuver na si baby po ay nasa cephalic presentation. Okay po? Okay, so start na po ako. Check po po. Okay. So, based on our findings po, mami, yung head po ni baby ay firm, and also po hindi na po natin namumove yung head ni baby, meaning to say po, naka-engage na po yung head po ni baby sa inyo pong pelvic or pelvis. Okay po? So, mami, sabihin ko lang rin po, meron po tayong tinatawag na flexion po and extension. So, yung flexion po ay, ito po yung cephalic prominences po, which yung head po ni baby is nasa same side po ng small parts. Okay po? So, meaning po, yung head po ni baby ay nakaharap po dito po sa small parts po na sa kanya. Okay po? So, pag sinabi naman po natin extension or extended, yung head po ni baby is naka-extend po or nasa side po ng back po niya, which is nakataas po yung kanyang ulo. Ganun po, no? Okay, so, okay na po ba? Mag-proceed na po tayo sa ating fourth maneuver. Okay, so yung fourth maneuver po natin is tinatawag din po nating pelvic grip. Okay, so ginagawa naman po natin ito para po ma-determine po natin kung yung ulo po ba talaga ni baby is naka-flexion po or naka-extension. Okay po? So, for our findings po, kapag nalaman po natin as I palpate po, and nalaman po natin na si baby po yung ulo po niya is nasa same side po ng kanyang small parts, meaning to say po, yun nga po is naka-flexion po or flex po yung ulo po ni baby. And kapag yung ulo po ni baby is napalpate natin and nasa same side po siya ng ating pong ng kanya pong fetal back, meaning to say po yung cephalic prominence po ni baby is naka-extended po. Okay po? Okay, so notice po na yung first three maneuvers po natin is nakaharap po ako sa inyo. Ang gagawin naman po natin para po sa atin pong fourth maneuver is haharap po ako sa inyo pong feet. Okay po, so ang i-assess naman po natin dito, mother, is starting po sa atin pong side po ng ating abdomen. So I will be palpating po or use my fingers po on the each side of your abdominal area po, and I will be going downward po sa inyo pong pubis. Okay po? Just to check po kung tama po yung ating pong assessment. Okay. Po, isa pa. Okay, that's all po, mother. So, based on our findings po, mother, is tama po yung ating pong nasa assessment, which is si baby po, yung ulo po niya is nasa same side po ng kanya pong small parts, which indicates po that the baby's head po is flexed. Okay po? So, in this fourth maneuver po, na-distinguish din po natin or na-locate din po natin yung brow po ni baby as well as yung na-assess po natin yung descent of the presentation. Okay po? Okay, so after that, we will now proceed to our next step, which is we need to assist our client or the mother or the upcoming mother to a position of comfort. So mother, okay po, pwede na po natin ibaba po yung ating paa. Okay, so pumutan ko na rin po kayo ulit. Okay. And after that, we will need to perform hand hygiene. And after that, we will be documenting our findings to the client's record, as well as we need to report our findings to our client. Okay. So based on our assessment, our patient is a woman that is in her 28 weeks of gestation with a obstetric history of G1, P0, T0, A0, and L0. So, mami, sabihin ko lang po yung atin pong findings, no? So, nung ginawa po natin yung first maneuver po natin is na assess ko po na si baby po ay nasa cephalic presentation because nung pinalpate ko po yung inyong pong abdominal area o yung inyong sa part po ng inyong xiphoid process, napalpate ko po is smooth or soft with bony prominences po. So, it indicates po nang napalpate po natin is yung buttocks po ni baby. Okay po? So, next naman po is yung ating pong sa second maneuver po. So, nung pinalpate po natin yung inyo pong side po ng inyo pong abdominal area, so come up po natin or na-assess po natin na yung back po ni baby is na nasa inyo pong left side while yung small parts po niya is nasa inyo pong right side, no? So, gaya po ng sinabi ko kanina, importante po na nalalaman po natin kung nasan po yung back ni baby para po doon natin ilalagay yung fetal heart monitor niyan, or we could use po yung ating pong stethoscope para po malaman po natin yung heart rate po ni baby. Okay po? And doon naman po sa ating third maneuver, okay po, nung gilinas ko po yung inyo pong lower portion po ng inyo pong abdomen area, so yun nga po, hindi na po natin na and na-touch po natin na yung head po ni baby yung ating pong negras. So, tama po yung ating nakuha po kanina sa ating first maneuver na si baby po ay nasa cephalic presentation kasi sa third maneuver po is nahawakan po natin sa inyo pong lower abdomen na yung ulo po ni baby yung ating pong nahawakan. Okay po? Okay po, so sabihin ko lang rin po na naka-engage na po si baby sa ating pong pelvis kasi po hindi na po natin magalaw yung ulo ni baby or hindi na po natin siya namumove or hindi na po natin siya na-lift. Okay po? Okay po, so for our fourth maneuver naman po, na-assess din po natin na yung head po ni baby is yung prominence po niya is on the same side po ng small parts po niya, which suggests that po na yung head po ni baby is flexed. Okay po? Po, mother. So, that is all po sa ating pong pag-report ng document. And sabihin ko lang rin po, mother, na yung ating pong assessment is pwede pa po siyang magbago hanggat hindi pa po natin nare-reach yung ating pong 9 months. Okay po? So, pwede pa pong magbago yung position ni baby. Okay po? So, I suggest po na before po tayo mag-labor or prior of the labor po, kuha muna po kayo ng ultrasound para po makita po natin yung talaga pong position po ni baby. Okay po? Okay, so thank you po, mother. So that is all for the performance of the Leopold's maneuver to a pregnant woman. And again, my name is Chris Daniel M. Sumamang, and I am a student nurse from Tarlac State University from BSN 2B. Thank you.